Let's talk about shingles. I know, when you hear that word, you probably picture something really nasty, a super painful rash. But what if it wasn't always like that? Today, we're going to dig into the milder side of shingles, something you might not even know exists.
You know that feeling when you get some weird, mysterious itch? Or maybe a patch of skin just feels tingly, and you're just like, what is that? It's so easy to just brush it off, right? But sometimes that little whisper could actually be your body trying to tell you something.
And that brings us to the big question. Shingles is supposed to be this awful thing with tons of pain and blisters. But can you have a mild case? Is that even a thing? Well, stick around because the answer is pretty interesting.
Okay, so first, let's get the technical name out of the way. It's called herpes zoster. And here's the wild part. It's caused by the exact same virus that gives you chickenpox. That virus can just hang out, totally silent, in your nerve cells for years, even decades, and then, boom, wake up later as shingles.
So back to our big question, can shingles be mild? The answer is a definite yes. It is absolutely possible to get shingles and not have that horrible pain or a huge rash that we all picture.
So, what are we even talking about when we say mild? Well, instead of that really bad pain, you might just feel a little bit of tingling or itching. And if you do get a rash, it's probably going to be pretty small, maybe just a few blisters, and it often shows up on your stomach or torso. And it turns out this is way more common in people under 50. Why? Probably because a younger, healthier immune system is just better at fighting the virus and keeping it from going haywire.
Okay, so let's say you think you might have a mild case. What happens next? How long is this going to last, and what should you be looking for? Let's walk through the timeline.
Right off the bat, one of the biggest and best differences is how long it lasts. A standard case of shingles can drag on for like 3 to 5 weeks. Ugh. But a mild case, it's usually done and dusted much faster. We're talking about 2 weeks max.
So here's the play-by-play for those 2 weeks. In the first few days, you might see some small red patches pop up. Then, after that, a few little fluid-filled blisters, the technical term is vesicles, might form. Don't worry though, those usually dry up and turn into scabs in about a week. And by day 14, the scabs clear up and your skin is pretty much back to business as usual.
All right, so knowing the timeline is great, but how do you actually deal with it? Let's get into treatment. The big question here is, can you just handle this at home, or do you need to call the doctor?
So for a lot of these mild cases, simple home remedies can actually work really well. But, and this is a big but, there are definitely times when you need to see a doctor. For sure, call them if your symptoms start getting worse or if the rash is anywhere near your face, especially your eyes. Also, if you're over 60 or you have a weakened immune system, don't mess around, just make the call. The risk of complications is higher in those situations, so you really want a doctor's opinion.
Okay, so if you're treating it at home, the name of the game is comfort. We're talking simple, soothing stuff. Cool compresses feel great. Calamine lotion is a classic for a reason. Taking an oatmeal bath can really help with the itch. Oh, and try to wear loose-fitting clothes made from stuff like cotton so you don't irritate your skin. And hey, it never hurts to load up on foods with vitamins A, B12, C, and E to give your immune system a little extra firepower.
Dealing with the symptoms is one thing, but you know what's even better? Not getting it in the first place, which of course brings us to the really important topic of the shingles vaccine. So who should be getting this vaccine? Well, the CDC has some pretty clear guidelines. They recommend the Shingrix vaccine for all adults who are 50 and older. It's also for adults 19 and up if they have a weakened immune system. And listen to this because it's super important. They still recommend it even if you've already had shingles or if you got that older Zoster vaccine years ago. Even if you've had the chickenpox vaccine, they still say get it.
And this really is the key. The vaccine is incredibly good at preventing shingles altogether. But its superpower doesn't stop there. Let's say you're one of the very few people who still get shingles after being vaccinated. Well, the good news is your symptoms are generally way less severe and the whole thing doesn't last as long. I mean, that's a huge win, right?
Okay, we've gone through a lot here. So let's just take a second and boil it all down to the most important things you need to remember.
All right, here are your key takeaways. Number 1, mild shingles is real. It's not always a nightmare scenario. Sometimes it's just some tingling or a tiny rash. Number 2, it's usually over pretty fast, like within 2 weeks. Number 3, you can often manage those mild symptoms at home with some simple remedies. And finally, number 4, that Shingrix vaccine is your absolute best defense. It helps prevent shingles, and if you do get it, makes it a much, much milder experience.
So what's the final thought here? Well, knowing that prevention is so effective, maybe the most important thing we've talked about is being proactive.
It kind of shifts the question, doesn't it? It's not just about how do I treat shingles, but more about what can I do to avoid it altogether. So maybe it's time to talk to your healthcare provider about prevention, yeah?